Conference, we've had a fantastic start to the morning. It is an incredible privilege to listen to Debs Hazeldine telling her moving story, and we are so grateful to you for coming to join us in Manchester. We also heard fantastic speeches from Kate Kettle on social mobility, Joy Morrissey on the horrors of candidate abuse, Dr. Ben Spencer on mental health equality, and Dr. Suzanne Bartington on the incredible importance of tackling health inequalities. Those last four speakers, they are the future of the Conservative Party, and we are so happy to have you in our family. I have a great team at the Department of Health, so let me start by thanking them. The wise Philip Dunn, the savvy Steve Brine, the smart James O'Shaughnessy, the street-smart Jackie Doyle-Price, and our perfect PPSs, Joe Churchill and James Cartledge. So please thank my team for their great work. Sometimes something happens that reminds you just how lucky we are to have an NHS. That happened right here in Manchester in May. When that bomb went off at the arena, we saw paramedics running into danger, doctors racing to work in the middle of the night, nurses putting their arms around families who couldn't even recognize the disfigured bodies of their loved ones. One doctor was actually on the scene picking up his own daughter when the bomb went off. Thankfully, he found her. But instead of taking her home, he quietly dropped her off with friends and went straight to work at his hospital without telling colleagues a word about where he'd been. It was the same heroism after the London attacks too. So let's start by thanking all those superb NHS staff for being there when our country needed them. Of course, they're there for us not just in national emergencies, but in personal ones too. When you're losing a loved one, when you're sick unexpectedly, when you're knocked sideways by a mental health crisis, the NHS is there, a national health service and a national symbol of British professionalism and British compassion. But it only exists because of its people. So today I want to recognise that supporting NHS staff is one of our most important priorities. We need more doctors, so last year I said we'd increase the number of doctors we train by a quarter, one of the biggest ever increases. We also need more nurses. So today I can tell you that we'll increase the number of nurses we train by 25%. That's a permanent increase of more than 5,000 nurse training places every single year. And we'll do that not just by increasing traditional university places, but by tripling the number of nursing associates, so people already in the NHS can become a registered nurse after a 4-year apprenticeship without having to do a traditional full-time university course. Derby, Wolverhampton and Coventry universities have already offered to run apprenticeship nursing courses on hospital and community sites, and others will follow, always making sure we maintain the high standards required by the nursing regulator. And we'll also launch a new initiative to encourage nurses who have left the profession to come back. Our NHS is nothing without its nurses. We need your skills, we need your compassion, and with today's announcement, we are backing the biggest expansion of nurse training in the history of the NHS. For nurses, as for all of us, pay and conditions matter. I've already said we'll decide next year's pay awards after listening to the independent pay review bodies. But there are other things we can do today. Nurses look after us, but they also have their own families to look after. Kids at school, a mum or dad with dementia, a partner coping with cancer. And if we're to get the best out of them, we need to be much better at supporting them with their own caring responsibilities. They need to be able to work flexibly, do extra hours at short notice, get paid more quickly when they do, and make their own choices about pension contributions. So today I'm also announcing that new flexible working arrangements will be offered to all NHS employees during this Parliament, and we'll start next year with 12 trusts piloting a new app-based flexible working offer to their staff. And like many people, NHS staff can also struggle to find homes near work that they can actually afford. So from now on, when NHS land is sold, first refusal on any affordable housing built will be given to NHS employees, benefiting up to 3,000 families. And there's one more group who quite understandably are a bit worried at the moment, and that's the 150,000 EU workers in our health and care system. So let me today say to them this: you do a fantastic job. We want you to stay, and we're confident you will be able to stay with the same rights you have now, so you can continue being a highly valued part of our NHS and social care family. Now, I became Health Secretary 5 years ago. It's a long time ago, but I'll never forget my very first week. Someone gave me the original Francis report into mid-staffs that Debs was talking about, and they gave it me to take home to read. I was absolutely gobsmacked. How could these terrible things really happen in our NHS? It got worse. The chief executive of the NHS told me I just better get used to the fact that all over the world, 10% of hospital patients are harmed. Another senior doctor told me there were pockets of mid-staffs-like problems everywhere. And academics told me that 3.6% of all hospital deaths were probably avoidable. That's 150 deaths every single week, causing immense heartache to families, as we heard from Debs just now. People like Debs, and what a privilege to listen to her this morning, made a choice. Instead of drawing a line under their personal tragedies and moving on, they chose to dedicate their lives to campaigning, reliving their sadness over and over again, just to make sure other families wouldn't have to go through what they did. And they also made my mind up for me. My single ambition as Health Secretary would be to transform our NHS into the safest healthcare system in the world, where this kind of thing never happened. But where on earth do you start? The first thing is to be honest about where the problems are. My kids are 3, 5, and 7. And I know exactly how good all the local schools are, thanks to Ofsted. Now, we had nothing like that in health. So against a lot of opposition, in 2013, we became the first country in the world to introduce the Ofsted system to healthcare, giving independent ratings to every hospital, care home, and GP surgery. The results were, to say the least, a big surprise. Have a look at this. 14 hospitals got an outstanding. Now, we assumed it would be the famous teaching hospitals, but in fact it was often trusts that no one had really heard of outside their local area, like Western Sussex under the inspiring leadership of Marianne Griffiths, which has probably the best learning culture that I've seen anywhere in the NHS. Or in mental health, Northumbria, Tyne and Wear, which I was lucky enough to visit on Friday, and is blazing a trail on the safety of mental health patients. So then we asked ourselves a difficult question. is good quality care just something you have to buy? Now, of course, money matters. You need enough nurses on your wards, and that costs money. But it turned out to be a more complex relationship. All trusts are paid the same NHS tariff. But if you look at this graph, on average, the good and outstanding trusts were in surplus, and the requires improvement and inadequate ones are in deficit. Why is that? Because it turns out that poor care is about the most expensive care you can give. If someone has a fall and stays in hospital an extra week, it's not just terrible for them, it costs the NHS more as well. But our biggest worry was about the trusts that we would end up putting into special measures. What would happen to them? Would they end up getting trapped in a vicious circle of decline? Well, 35 trusts went into special measures, nearly 1 in 5 of all NHS trusts. And so far, 20 have come out. What happened? Take Wexham Park Hospital in Slough. When they went into special measures, the Care Quality Commission said their care was unsafe. 6 of their 8 clinical areas needed improving. And if you ask staff in that trust, the majority said they wouldn't recommend their own care to a friend or a member of their family. Just think about that. The staff themselves said their own hospital's care was not to be trusted. 2 years later, under the extraordinary leadership of Sir Andrew Morris and his Frimley team, things were transformed. All 8 clinical areas were good or outstanding. More than 2/3 of staff were recommending their own care, and the trust became one of only 8 in the country to go straight from special measures to good. Let's give a big round of applause to all those trusts in special measures. I learnt then, perhaps the most important thing that I've learnt in my time as Health Secretary. The staff in every trust going into special measures are exactly the same as the staff when that trust comes out of special measures. In other words, it's not about the staff, it's all about leadership. And we also learned that you can't impose quality or safety from above. It has to be part of a culture that comes from the bottom up. And that starts with openness and transparency. Let me show you how transparency works. After mid-staffs, we were worried about the staffing levels on our wards. But rather than a top-down edict telling trusts to recruit more staff, we did something simpler. We just asked every trust to publish every month the number of nurses employed in each of their wards. What was the impact? Well, this graph is the total number of nurses employed in adult nursing in the NHS. And you can see from the red line that in the first 2 years from 2010, they actually went down by just under 5,000 nurses. Then we introduced ward-by-ward transparency. And what happened? The blue line is the number of nurses trusts planned to recruit. In other words, they were planning to lay off even more nurses. The green line is what they actually recruited. So once we started being transparent about nurse numbers, the NHS ended up with 18,000 more nurses than it planned. And the public noticed too. Over that period, inpatient satisfaction rose to record highs. We also introduced transparency in areas like mental health, our major priority under Theresa May's leadership. We're leading probably the biggest expansion of mental health in Europe right now. But progress across the country has been patchy. So we're using transparency to make sure that wherever you live, as Ben said, mental health conditions are always treated as seriously as physical health conditions, and that is a central objective of this government. By shining a light on problems, transparency saves lives. But it also saves money. Every time someone gets an infection during a hip operation, it can cost £100,000 to put right. So under the leadership of Professor Tim Briggs, we started collecting data on infection rates across the country. What did Tim find? He found that in our best hospitals, 1 in 500 patients get an infection. But in our least good hospitals, it's as many as 1 in 25 patients. Putting that right is now saving hundreds of millions of pounds, as well as reducing untold human misery. So never let it be said that you can't afford safe care. It's unsafe care that breaks the bank. Now, what's been the overall impact of this focus on safety and quality? All of us here know the pressure the NHS is under. But despite that, the proportion of patients being harmed has fallen by 8%. That's 200 fewer patients being harmed every single day. Staff are happier than ever with the quality of the care they're giving. And the proportion of the public who agree that their NHS care is good is up 13%. This July, an independent American think tank, the Commonwealth Fund, said that the NHS was the best and the safest healthcare system in the world. That's better than America, better than France, better than Germany, and just ahead of the Ashes, better than Australia as well. But, and there is a but, we still have those 150 avoidable deaths every single week. Twice a week, somewhere in the NHS, we leave a foreign object in someone's body. 3 times a week, we operate on the wrong part of someone's body. 4 times a week, a claim is made for a baby born brain injured. We may be the safest in the world, but what that really means is that healthcare everywhere needs to change. In America, Johns Hopkins University says medical error causes 250,000 deaths a year, the 3rd biggest killer after cancer and heart disease. Conference, I want the NHS to blaze a trail across the world in sorting that out. So we have big campaigns right now to tackle E. coli infections, reduce maternity harm, make sure we learn from every avoidable death, and most of all, keep our patients safe over winter. But we need to do something else too, and that's get much better at supporting doctors and nurses when they make mistakes. Everyone makes mistakes, but only doctors and nurses have been brave enough to choose a career where the price of those mistakes can sometimes be a tragedy. And when that happens, no one is more devastated, no one keener to learn and improve than those same frontline staff. But we often make that impossible. They worry about litigation, about the GMC, about the NMC, about the CQC, about being fired by their trust. Unless we support staff to learn from mistakes, we just condemn ourselves to repeat them. And that means we have to dismantle the NHS blame culture and replace it with a learning culture. The world's largest healthcare organisation must become the world's largest learning organisation, and it's my job and my mission to make that happen. Now, next year, the NHS has an important birthday. Like Prince Charles and like Lulu, the NHS will turn 70. Here are the words of the health minister who announced its formation back in 1944.
Our plan is a service which will provide the best medical advice and treatment for everyone, every man, woman and child in this country. Whatever your income, if you want to use this service, and nobody's going to try to make you unless you want to, there'll be no charge for treatment. The National Health Service will include family doctors, whom you can choose for yourselves, and who will attend you in your own homes when this is necessary. It'll cover any medicines you may need, specialist advice, and of course hospital treatment, whatever the illness. Special care for mothers and children, and a lot of other things besides. In fact, every kind of advice and treatment you may need. This has got to be not only a full service, but also a really human and personal service.
Now, Nye Bevan deserves credit for founding the NHS in 1948, but that wasn't him, or indeed any Labour minister. That was the Conservative Health Minister in 1944, Sir Henry Willink, whose white paper announced the setting up of the NHS. He did it with cross-party support. And for me, that's what the NHS should always be. Not a political football, not a weapon to win votes, but there for all of us, with support from all of us. So Conference, when Labour question our commitment to the NHS, as they did in Brighton last week, just tell them that no party has a monopoly on compassion. It's not a Labour health service or a Conservative health service, but a national health service that we built and are building together, as I've said many, many times. And the next time they question our record, just tell them we've given our NHS more doctors, more nurses and more funding than ever in its history. Tell them that when they left office, the NHS wasn't even rated the best in Europe, let alone the best in the world, as it has been twice on our watch. And most of all, tell them that if they're really worried about the NHS being destroyed, then there's one thing they can do. Ditch Corbyn and McDonnell's disastrous economic policies, which would bankrupt our economy and bring our NHS to its knees. Because the economic facts of life are not suspended for the NHS. World-class public services need a world-class economy, and to ignore that is not to support our doctors and nurses, it's to betray them. However, unlike Labour, we don't, in this party, make the mistake of saying the challenges facing the NHS are only about money. If they were, we wouldn't have had Midstaffs, Morecambe Bay, and all those other tragedies that happened during bumper increases in funding. As Conservatives, we know that quality of care matters as much as quantity of money. So when we battle to improve the safety and quality of care, we are making the NHS stronger, not weaker. And we are reinforcing those founding values of the NHS that we just heard, namely that every single older person, every single family, every single child in our country matters, and we want all of them to be treated with the same standards of care and compassion that we'd want for our own mum or dad or son or daughter. And that conference is why we're backing our NHS to become the safest, highest quality healthcare system in the world, and we will deliver the safest, highest quality healthcare system in the world. Thank you very much.